Welcome to Season 3 of Students of Mind, the podcast that's all about opening up and normalizing discussions about mental health in ways that anyone can comprehend. In the first 2 seasons, we sat down with mental health experts and survivors to give you a full circle picture of each topic. In this new season, we will continue to explore the world of mental health through the insights of experts, healers, and individuals with lived experience. From alternative healing modalities to living with multiple illnesses, this season we will cover a wide range of topics with the help of a diverse selection of guests. My name is Jayde, and for today's episode, I sit down with Phoebe Bell to get a look at the new implementation of 988, the new mental health crisis hotline. I also sit down with Gunaratne to talk about what it's like working as a crisis line counselor. I hope by listening to the show, you're able to learn something new and gain some encouragement through hearing our experts and listening to the journeys of our guests. However, this show is not a substitute for professional advice, diagnosis, or treatment. Always seek the advice of your mental health professional or other qualified health provider with any questions you may have about your condition. Never disregard professional advice or delay in seeking it because of something you have heard on the Students of Mind podcast. Today's first guest is Phoebe Bell. Phoebe is the Director of Behavioral Health for Navada County in California. Previously, Phoebe has worked for several mental health and family support nonprofit organizations, and she now oversees the mental health and substance use disorder services in Navada County. Welcome, Phoebe. Thank you so much for being here today.
Thanks for having me.
Before we get into the topic of today, can you tell us a little bit about yourself and the work that you do?
Sure. I am the Director of Behavioral Health for Navada County, which, for any listeners that don't know, is a small rural county in sort of the Sierra foothills and up and over into the Truckee area here in California. And we provide mental health and substance use disorder services to folks in our county who are on Medi-Cal, and on the mental health side who have more significant mental illness, and then to anyone on the substance use treatment side.
Great. So today I wanted to talk to you about what to do when there's a mental health crisis. I know this year the 988 number was announced, and I think that has brought up a lot of mixed emotions for people, so I'm excited to get into that with you. But first, can we just talk about what is a mental health crisis?
Yeah, it's a big question, actually,
Yeah.
and a little bit of a hard question. I think once upon a time when we set up kind of mental health crisis resources, the predominant situation we were trying to solve for was somebody who is feeling really deep and dark and depressed and suicidal, essentially. And so a lot of resources are geared around supporting somebody in a moment of feeling suicidal and how can we help keep that person safe. But mental health crises can take a lot of forms, and they can certainly be that, somebody who's at risk of hurting themselves. They can be somebody that's really actively psychotic or kind of working with a lot of stimuli that are keeping them a little bit disconnected from reality and maybe causing them to act in ways that are alarming to other people or are potentially getting themselves into dangerous situations or getting themselves into trouble. It can be people under the influence of substances and acting erratically or unsafely or whatever. It can be somebody who's really a danger of hurting somebody else. They're really angry or really paranoid. And I think people can go into crisis where they've sort of lost control of making good decisions about their well-being for lots of reasons. It can be because of a serious mental illness and again, psychosis and not, responding to confused or different sense of reality. But it can also be, like I said, because of stressors outside of themselves. And so what we expect our crisis system to respond to, I think, is really grown in scope and breadth and complexity. And those different scenarios kind of need different solutions sometimes. So I think that's one of the challenges that faces us.
Yeah, it definitely sounds like I don't know, there's not like a template or a blueprint for how to deal with the mental health crisis because they can look so different person to person.
And I think it's the other thing that we all have to remember too is that when things go sideways for somebody having a crisis, we all know from so many examples in the media, it can get really dangerous really quickly for that person and for others around them, including law enforcement. But our kind of traditional system of response for many years now has been to have law enforcement be sort of the first line of intervention, and that can escalate really quickly and have really, really poor outcomes, again, for everybody involved. And I think that's a lot of what's precipitating sort of a broader push to say, wow, we haven't really grown up a crisis response system in the ways that we should have for the challenges that people are facing. And then I think it's also been exacerbated by the number of people experiencing homelessness in our country. And therefore, a lot of people's crises are happening in public settings that maybe would have happened behind closed doors. And it's a different set of risks for a community when somebody has lost control in a public setting. There's a lot more people that can be impacted, and the level of discomfort gets higher and the level of response intensifies. And so I think that's also contributing to sort of why we're more broadly looking at how we do crisis response.
So right now, like let's say someone's having a mental health crisis, what happens when someone calls the police to deal with that situation?
So it depends right now a lot on where you are in California or in the country even. There's sort of different resources in different places. But generally speaking, if somebody calls 911 there and says, I'm having a crisis, I might kill myself, or I'm really angry and I've got a gun, or whatever it might be, law enforcement will respond. In some places, they respond in conjunction with a mental health professional. Those are called co-responder teams, and you have both perspectives there: somebody to assure safety and somebody to look at psychiatric and behavioral health needs and challenges and resources. In some communities, there's already a system in place to sort of have the dispatch worker triage a little bit and understand the level of risk and the complexity of what's going on and decide, can I send just a mental health crisis team, or do I need a co-responder or just law enforcement response? And that's probably the ideal scenario. And then in some communities, law enforcement is the only option. Within those communities, many law enforcement officers at this point have been through pretty extensive training around how to manage mental health crises, how to de-escalate situations, et cetera, but not everybody. And so even that response can differ a little depending on what kinds of training that law enforcement officers had.
Yeah, so shifting into this 988 number, so this is supposed to be like the 911 for mental health. So like what can we expect from this? What can we expect when we call this number, and how would it be different from calling 911?
Sure. So the vision of 988 is exactly like you said, and really a great vision that eventually we will have a robust crisis system that is, intertwined with but separate from law enforcement and separate from hospitals, and instead recognizes that behavioral health crises are their own situations and need their own types of response system. And so the vision really is a parallel universe where instead of calling 911, you call 988. Instead of a patrol car pulling up, a mobile crisis team pulls up of mental health professionals. Instead of taking you to the emergency department, you're taken to a place specific for behavioral health crises. That is the ultimate vision, and it's a really great vision. And the reality is we have a little ways to go until we get there. And so in California, we're building the 988 system on top of what was the National Suicide and Prevention Hotline capacity. And so prior to 988 going live, if you called the National Suicide Hotline, there's a network of call centers throughout the country that your call would be routed to depending on where you're calling from. So in my county, in Nevada County, if you called that number, you would get routed to a call center in Yolo County that answers the phone for about 10 counties. With 988 going live, that call is routed just like it were a suicide prevention hotline call. So it goes to that same call center. So the good news is what will happen is your call will be answered by a trained volunteer who are super skilled at de-escalating somebody who's suicidal or in crisis, talking them through that moment, assessing for risk, calling for law enforcement support if needed, and ideally connecting the caller with some resources. However, it's, again, typically been a suicide prevention hotline. And while they've certainly handled an array of crises, that's really been the focus. And so as we get into some of these other types of crisis situations that can happen, or where some kind of in-person response is needed, in much of California and much of the country, that 988 call center isn't connected in with the local crisis system. And so they're not able yet to dispatch a mobile crisis team or let you know about the crisis stabilization unit down at the hospital and help you figure out how to get down there or whatever it might be. That's sort of a future state thing, is how to link those call centers, especially the ones that cover big geographic regions, to the local crisis system so that they can effectively make that connection, or to expand the number of call centers that are answering those calls so that they're a little bit more localized, so that you're not, because I think we've all had that experience, whether it's for a crisis or something much more benign, like a customer service type of thing. And you think you're calling your local store and suddenly you're being answered by somebody in a different geography, and the disconnects start happening pretty fast. They don't know what's happening in your community or whatever it might be. And so I think that's one of the things we're all struggling with right now is like, how do we have that 988 response system link into the rest of our local crisis services? But again, the good part is it's super exciting to just have a simple number. Like, honestly, as somebody that works in the field, I'd always have to like look up the National Suicide Hotline number. It wasn't stuck in my head. And 988 obviously is very simple to remember and share with people. And that's the most important thing. When somebody's in crisis, that everybody in the country eventually knows, just like a little child knows, call 911, that every person knows you can call 988 and get some help and get some support. That alone is an improvement for our system.
Yeah, I definitely agree. I think this kind of just pushes mental health into a space where it's like trying to encourage people to take it more seriously. So I think it's great in that sense. And yeah, you already mentioned like the pros and the cons of this new number. And I think it sounds like there's a lot of work to do with it, but again, even just having it, like the message behind it, I feel like is really good. Yeah.
And I think, one thing that I was talking about with somebody recently that's helpful to remember is, as long as I've been aware, 911 has just been there, and we all know about it, and we all know how it works, and it's a seamless system. And they were reminding me that it didn't just start like that. It didn't suddenly magically work everywhere all the time exactly how it's supposed to. It took years to build into that system, and that's helpful perspective to keep. We are in, the first stage of this massive system transformation around crisis services, and it will continue to grow and improve and strengthen over time and be more effective, which is cool. And then definitely to your point, like the really most important thing is really like the focus on the fact that a mental health crisis is a real crisis, and we've underplayed that for so long, and we've not taken seriously the struggles people experience, and to elevate that right alongside a 911 call is so important and helps so much with breaking down some of the stigma around reaching out for help. And that's probably the most important thing that 988 has to offer is, hey, it's no big deal. Just call 988. Somebody's there to talk to you. That's a really lovely thing.
Yeah, that's so great. So before we wrap up, can you give us some, like, if someone's listening who themselves or has a loved one experiencing a mental health crisis, what are some steps that they can take?
I think the most important thing, if you're worried about somebody, is to sit with them and talk to them. I think most people get really anxious about having a hard conversation with somebody that they're worried about because they're really scared of asking questions that they're not sure how to handle the answers to. And so most specifically, people get really anxious about saying to somebody, are you feeling suicidal right now? Are you having any thoughts of hurting yourself? Those are scary questions to ask because if the person says yes, then what? But the reality is, it's the most important question to ask. And for people who are feeling that way, there's so much relief in having somebody put it on the table and open the door to that conversation. And just because somebody says they're suicidal doesn't mean you're in a panic. That's when you say, great, I know a resource. Let's call 988. They're going to help us figure out how to get you through this moment. Or if you don't have access to that, call 911. And if you don't have access to that, sit with that person and take them down to the local hospital and get them assessed there. But asking that question is the first step to them connecting into reaching out to help. And the reality is, while we all want professionals to do that in certain ways, that most of us really rely on our natural support networks for love and kindness and support and friendship and caring. And asking those questions and connecting somebody to resources is most likely to happen from that friend, loved one, coworker, whatever it might be, more than from a professional. And so that's the most important thing is like, don't be scared to have real conversations with people when you're concerned, when you see things that are worrisome. And the worst thing that would happen is it's an awkward conversation when the person's like, what are you talking about? No, I'm just sad because my dog died, but that's normal, or whatever the thing is. And you're like, great, so glad to hear that. Hey, let's go for a walk together and tell me more about your dog. Or, I don't mean to make trade of it, but you know what I mean? Like, that's the worst thing that could happen is that you're totally off base. And then, though, now that person knows that you're a safe person to talk to because you're willing to bring up that subject. And if they ever did get to a really hard place, they might be willing to come to you. And people want to know that, like, who can handle having those conversations and being open to hearing about hard moments.
Yeah, I love that. I think I just recently took a training on, it was just a suicide prevention training, and it had you practice asking someone if they're thinking about suicide. And even being in this space and working in this space, for me, it like brought up some feelings. So I think it's great that you mentioned that it's very important to ask that question, even if it just leads to an awkward conversation. It's so important to get that question out there and let that person know that the space is open for that.
Yeah, well said. Exactly.
So before we wrap up, something I do for all of my guests is so for this season, I want to put an emphasis on self-care because I had an experience at the beginning of the year where I had to take time for self-care, and I just realized that that's what was missing for me. So my question for you is, what is one thing that you do each day to maintain mental wellness?
That's a great question. I'm going to share a couple things, actually, if that's all right. So for me, I live in the mountains, in a mountain town called Truckee, and being outside and being in my physical body are a lot of how I take care of myself. My job is so in my head and in my heart. And it, to me, balancing that out with time in my body. So hiking, biking, running, and whenever I can do those things with a friend, so I get that connection part as well, that much the better. But I try most days to find something like that to do. But I also have been working really hard at more of a gratitude practice. And I just feel like that's one of the most powerful things I've done for myself around reframing hard days, et cetera. And Somebody gave me the acronym of GLAD recently. And so most nights when I'm falling asleep, I think of one thing I'm grateful for, one thing I learned, one thing I accomplished, and one thing that gave me delight, which I love, something delightful. And it's just a really nice way to close out my day. So
Great. Yeah, I love that. I might steal that one. All right.
it's awesome.
So to wrap up, can you give my audience and I some ways to connect with you or stay up to date with the work that you're doing?
Well, I'm sort of a Luddite in the social media universe, so you can't follow me anywhere or anything like that. But you're always welcome to reach out to me at Nevada County Behavioral Health Department. Um, and then I am involved in our state association of behavioral health directors, and the California Behavioral Health Directors Association is a great organization to follow in terms of understanding kind of what's coming on sort of the policy and new programming ideas, kind of on the cutting edge of the public behavioral health system in California.
Okay, great. Thank you so much for being here today. I really enjoyed this conversation. I think this was insightful, and I think it will be helpful and interesting for people to hear about this new implementation of the number. So thank you for being here and providing all this information.
Thanks so much for having me and for creating the space for these kinds of conversations. It's really great.
Today's second guest is Gunaratne. Dylan is an entertainment professional and law student at Southwestern Law School in Los Angeles, California. In previous years, Dylan spent time volunteering as both a crisis line counselor and hospice worker. In our discussion, Dylan shares with us his experience working as a crisis line worker and what he's learned as a result. Good morning. Welcome, Dylan. Thank you so much for being here this morning.
Thanks for having me. I'm really excited to talk to you.
I'm really excited too. I'm glad we were able to work this out. Before we get into the discussion, can you tell us a little bit about yourself and the work that you do?
Well, first of all, thanks for having me. My name is Dylan Gunaratne. Pronouns are he, him. Currently, I am in law school, but prior to law school, I was a volunteer with the D.D. Hirsch's Suicide Prevention Center. And they took it, which is in Culver City, California, in LA. And they took calls from the National Suicide Prevention Lifeline. They also took calls from the Teen Line after hours. So with that center, I had experience like receiving or taking calls as a crisis line counselor for different lines. But yeah, I was a volunteer for about 1.5 years, I think. And then since then, I've just been working in the entertainment industry and then started law school in the last 1.5 years, almost 2 years now. Yeah.
Nice. I'm excited to talk to you about your time as a crisis line worker today. I think that's so cool that you did that as part of like your journey. So let's just dive into it. Can you tell us like what inspired you to become a crisis line worker?
I think initially what I wanted to do was I wanted to work and do something in mental health that was more sort of intimate with people. So at the time I was in college, I was at Cal State LA, and I was running our National Alliance in Mental Illness NAMI on campus group. So with that, I was doing events on campus and stuff like that. So we got to meet with students, and we would do we had this one annual event that we did called #StigmaFree, which was which is an event we had like mental health resources for students and things like that, and like performances and stuff. And so, but I also wanted to do something a bit more in the community that was just separate to my work with the school. So I think with the crisis line, I don't know, something drew me to it. The idea of being able to connect with someone one-on-one on the phone and be like a very small part of their life for, however many minutes, but be so impactful. I think that whole idea just kind of spoke to me. And then when I went to the timing didn't really work out well with me for some other organizations. And then it worked out well with D.D. Hirsch. And then I was able to go through the training. I met some incredible people that were also volunteering. And then I just knew this was right for me and I really wanted to try it. So Yeah.
So, what was the training process like to become a crisis volunteer?
The training process is actually pretty long. I think initially you sort of do obviously I don't know how it goes with every organization, but with the one I did, they had an initial application where it asked stuff about you, and then you actually go through like, I think it was a month, it might have been 2 months long of training where every weekend you would come and like go through a presentation of like suicide prevention information, and it would go through kind of their model, and it would talk about like what their like how we talk to callers, and then we would do role play exercises. But it went on for like a couple months, and that pretty much prepped us because we would do role play exercises with the other volunteers, with the coordinators and stuff like that. And then we had a full, I think it was a 1 day assist training, which stands for Applied Suicide Intervention Skills Training. So that's a workshop that we had to do as well. It's a 2 day training actually, that we did in conjunction with the 2 month, as part of the 2 month training to start taking calls. And then once you start taking calls, you actually have the supervisors listening in on your calls for the first little bit, and then we'll debrief with you after the call, talk about it and stuff, how it went, how things could have gone better, and then take on the next one. So yeah.
That's really nice that you had that support from the supervisor as you first went in. I think when I think about doing this kind of work, it's like, whoa, this is like interacting with people who are going through something really intense. And so, yeah, I just would want a large supervisor presence there so I would feel comfortable with, speaking to someone in that position.
Yeah, 100%. It's very intimidating at first. I think most people feel like a little bit nervous about doing it. So I think once you have the first couple calls where you have a supervisor listening, and then you can always like IM or message them like during the call and stuff like that to kind of like get some support. And so yeah, it's definitely, you're never like alone. You're never doing it 100% by yourself. Like you always have people there to help you and guide you.
That's good. So as you were in this position, in this role, what were some of the lessons that you learned during your time?
One of the big lessons I learned was that I think when you start being able to just, I think active listening is such a hard skill, first of all. So it's a hard skill to hone in on and like develop. So this experience really helped me with that. I think it helped me realize that, when you can talk to someone on the phone in a situation like a crisis line, and you can put yourself in their shoes, and you can literally just imagine being on the other side of the line and talk to them and kind of put yourself in their position, you're much more likely to develop like a real, genuine connection one-on-one with that person. Because people can sense when you're kind of just listening just to listen, or you're not really there, or people can kind of sense that even over the phone. I mean, when you're talking to someone on the phone who's experiencing a high level of stress or anxiety or depression or whatever, what have you, I think you just have to really be careful about really making sure you hang on every word almost. I mean, and that's helped me a lot with my daily life, and even with work and school and everything. I've just learned a lot about just taking a step back and like putting myself in the other person's shoes that I'm speaking to, or just really, really trying to hang on every word that someone says and try to read between the lines and understand what the context is and what they're trying to say, what's not being said too. So I think that's one big takeaway I've taken away from the crisis line that I just am so grateful for.
That's beautiful. Yeah, so let's kind of like talk about what your day to day like was as a crisis line worker. Like what were some of the ways that you supported people when they called in, and like what were some of the common issues that people brought up when they called in?
Okay. Yeah, so the typical shift is sort of like it's usually, I mean, at least with the organization I was volunteering with, it was sort of like a 4-hour shift, where you would go to a disclosed location, or undisclosed location. Like you would not be told where the call center is. I think for privacy reasons, like we don't like necessarily like to disclose the address of the the crisis center. And so you get after you do all the training, you get usually like a 4 hour shift. And I did only once a week. So I did a 4 hour Sunday shift. And basically once you get there, you pretty much jump right on the calls. You jump right on, you pick up, you get in the call booth and you take your first call. And, sometimes a call can last from 15 minutes to 30 minutes, depending on the level of stress that the person's experiencing or distress. So what you initially would do is when you're first taking a call, you would do some sort of assessment of safety. So that's not always the case. I'm not sure. I'm just speaking to my experience, but so you would do a general risk assessment of sort of where they're at. Are they likely to commit suicide? Are they in the middle of an attempt? Are they just thinking about it? Are they calling on behalf of a friend? Are they calling on behalf of a loved one? Do they want to get more information? Are they following up from a previous call? So you'll get this information beforehand because usually this call gets screened and will have like at least some general information so the supervisor can pass it to you. Sometimes that's not always the case, but I remember that would happen sometimes. And then you just start talking to them and you do a risk assessment and then you start kind of talk about what they're experiencing. A lot of the times callers will experience there's a lot of loneliness, just generally just a lot of loneliness and suicidal ideation. Sometimes callers would be more on the end where they're actually likely to attempt and they're like have a plan. And so you want to ask questions like, do you have a plan? Have you attempted before? And you want to get more information from them. So I think typically, a call will last about 15 to 30 minutes depending on the situation. And then, so you would talk to the person, sometimes offer a follow-up call. That's not always the case. And because of the nature of these lines, like a lot of the times people will call back again. So people will call and they've called a couple times and they really use the line as a resource for themselves. And that's great. That's what we encourage people to do. So we do have callers that will have like, a story that they've been like talking about with other previous volunteers or things like that. So so then the shift will last about 4 hours and you pretty much go, call after the call. And then sometimes you'll take a break and whatever, but usually you go out call after call, especially, during that time. And I was volunteering during like 2017, 2018. And even then the calls were pretty high. The volumes were pretty high, but I know that the volumes have increased a lot since then. And a huge part of that is just because people's awareness that these lines exist and, being able to conveniently dial, a 3-digit number now versus being able or having to call these various local numbers. So I think there's, I'm sure volunteers today, who do a typical 4-hour shift get a lot more calls than I did when I was doing mine. But I did get a lot. And it was, so the typical shift kind of goes like that. And then after your 4 hours, you're free to go. And then you go back to your normal life and then you wait till your next shift the next week, And sometimes people take night shifts. Some people do, because these lines are 24/7. So people are there, volunteers are there overnight and taking shifts and taking calls. And I commend those volunteers that do that. So, so that's kind of what the typical experience was like for me. I think there was sometimes some paperwork you'd have to do. For instance, if there was like a suspected child abuse situation, there might be other reporting that you would have to do and documentation you'd have to follow up with. But other than that, you pretty much are talking to people. And then a lot of these organizations, you'll have to do like a 1 year commitment. Like you'll have to commit upfront to doing a 1 year when we're with the line. Otherwise, so I don't know if everyone does that. I'm not sure, but that's what mine did. And so I ended up doing that. And that's why I was there for a year and a half. So, but that's a typical shift. Like,
What, if anything, like what were some of the things, because these can be intense calls. So what were some of the things that you did to kind of like debrief yourself after a day of being on the phone line?
they can be very difficult conversations, obviously, to experience. I think one thing I would do, I love music. Like, so when I would drive, my drive back home, I would just listen to music and I just would kind of like think about the calls that I had. And honestly, I remember feeling a lot of gratitude actually after my shifts, because I would have such positive experiences with my callers. Like I would have like a lot of positive movement in the right direction, or someone would start a call feeling really, really unsafe and feeling like that they're, you know, at risk of, harming themselves. And then by the end of the call, they're thanking me for talking to them, so things, I mean, those experiences really stay with you. And so I remember just thinking about those experiences, just driving back home, listening to music and thinking about them. I feel so much gratitude just to be able to be a volunteer and have those calls with people. So that really was a big way for me to like kind of settle the whole experience in my mind and heart, when I would leave. But I think a lot of the times you also lean on your other volunteers and you lean on your supervisors, because I remember I would talk to the volunteers like during small little breaks or between calls. I would talk to the volunteers and we would all, kind of understand what we're all going through and stuff. And the supervisors that I worked with were incredible, and so they would always give great advice and be able to guide you like that too. So I think it's a sort of up to you ultimately like how you want to take these calls and these experiences and like sort of integrate them into your life as you move forward, right? So that's kind of what I did.
Beautiful. Yeah, I think that's so. I wanted to ask that because I think that's so important when doing this type of support work, to take care of yourself as well.
Yeah.
As someone who was doing this kind of work and coming into contact with people in distress, do you have any advice for people just in everyday life who may come in contact with people in distress and needing some support?
Yeah. I mean, generally, I think one thing to always remember is that a lot of the times whatever someone's experiencing has nothing to do with you, right? It's so easy to personalize like someone else's like distress and like whatever they might be going through and be like, oh, this is directed at me, taking it personally. So I think just as a preliminary matter, just realizing that everyone's going through something and it's not always directed at you and it really isn't about you. So it's kind of nice to just remember that, I think, because as much as we want to even help people through their things and what they're going through, it's ultimately up to them and it's their lives, right? So, but I think generally what we can do is help point people to the right resources and also let them know that they have someone that can listen to them. So a lot of it, like with our currently in law school, I'm part of this NAMI group, this National Alliance of Mental Illness group that we provide resources to students. So if anyone was experiencing distress and was talking to me about it, I would want to first be able to ask them, hey, have you been able to connect with therapists? Like, have you connected with, um, you know, any other resources around you? And so sometimes people are in the process of looking for those things or whatnot. And if they're in the process of looking for more support, then I would be able to point them to some local resources and things. There's so many websites these days and so many online resources for people to find therapists, to find low cost therapy, to find even group counseling sessions. People don't feel comfortable talking about their feelings as much. Sometimes group counseling could be a great way to or group support groups and things like that too, because a lot of times you're just there to listen and hear other people's sides and other people's stories. So I think being able to just like kind of bring up different like opportunities and things for people to take part in to like help themselves is really great. Like even just mentioning it, because ultimately you can only really give someone the option and they have to choose it themselves. So I think talking about how there's other alternatives to just therapy, just talk therapy, is also helpful, because sometimes people think, oh, well, I don't want to do therapy, so I'm not going to be able to seek any support. But that's not the case. There's so many other things you can look for and do. So I think first being able to help point people to resources, and then also like I mentioned about being like an empathetic listener, which is very difficult because sometimes if a friend is experiencing something, you want to just tell your friend like, stop, like you're being ridiculous right now, and like you need to just, and sometimes that can be helpful and sometimes it's not. So it's a very fine line, and it goes almost like every relationship is different. Every relationship is different. You have to know the person, you have to know, and your relationship with that person is unique. So I think, but I think at the end of the day, what crosses like what covers the whole board is that if you're if you're a safe space for someone in the sense that you're an empathetic, non-judgmental listener, people will want to be able to open up, or people want to open up to you most likely, because at the end of the day, people want to be heard. And so there is a fine line sometimes when you really care about someone, like having to be a space to empathetically, non-judgmentally listen, and then also want to be able to actively problem solve with them and help them and find the resources. So that is, I think, sometimes the line that we all walk with our loved ones and like our friends and stuff. And it's difficult because our role isn't necessarily to be a professional support like that, but we can certainly help guide people, at least showing them like what other resources are available. So I think a lot of the times too, like these helplines are also for people who need to help someone else. So like the crisis line, for instance, it's a wonderful resource if you are experiencing, or if you have a friendship, or if you have like a friend in your life that is experiencing a mental health crisis, and you want to know how to help them. You can call the crisis line yourself and ask them, hey, like this person's been posting these things on Facebook, and they've been texting me like cryptic messages and things like that. Like, I don't know what to say. And a lot of times these volunteers can help you figure out like, okay, how can we plan what our next steps are to support this individual and you, because it can be very distressing just trying to help someone else who's undergoing a mental health crisis. And people tend to forget about that the caregivers and the friends in your life, like they're experiencing a lot of stress too. So I think utilizing these helplines, even the NAMI helpline is a great helpline as well, which and volunteers can help you figure out how to best support an individual that you love. So those are my recommendations. I think it's always like, it's very gray. There's no black and white answer to any of this, right? So that's why I think it can be very tricky, but yeah.
Yeah, no, that's great. I love that you mentioned like support people can reach out to the helpline too, because that's such a great resource.
Yeah.
I know as support people, we can sometimes feel so helpless. So knowing that resource is there is really great. To wrap up, I have a signature question that I ask all my guests. And this season, it's about putting an emphasis on the importance of self-care. So my question for you is, what is one thing you do each day to maintain mental wellness?
Well, there's a couple of things. So I like to burn sage. So I have this like white sage that I burn, like a total hippie in my apartment. But I do burn it. I like to burn it every day, like it's sort of as a ritual thing. So I think a lot of the times with these spiritual practices or these self-care practices, they have to be consistent. Like whatever it is, like just do it consistently, right? So that's what I try to do with the sage. I try to burn it every day. And so that's one thing. The second thing I do is also music. I mean, I mentioned before I love music. So I love to make playlists. And so that's actually one of my big mental health like self-care things is making new playlists and like finding new music. I love finding new music and like new electronic music and things like that. New artists I haven't listened to, and making playlists for friends and stuff. So that's really makes me happy. And then also finally, I'm not as, of course, I'm a total hypocrite, but I'm not as consistent with this as I should be. But I do a gratitude journal. I have a gratitude journal I write in, and I don't do it every day. I should be, but I try to write in it every night, and I write 3 things for the day I'm grateful for. So that I got from Oprah. So I try to do that, but again, I'm not as consistent with that. But as long as you can do one thing every day, I think that's pretty good. So I got the sage thing down. I feel good about that.
Yeah, I was gonna say 3 things is big for self-care every day. So that's great. Thank you for sharing. Thank you so much for this conversation. I learned so much, so I'm sure other people will learn something too. And I'm just glad I got to sit down and talk with you about your experience. So thank you for being so open to sharing.
Thank you so much, Jade. It was great meeting you and talking to you. And, I encourage anyone who's even thinking about volunteering on a crisis line to look into it more. And if you have that sense of like, this might be a really great experience for me, and you're drawn to it, I think I would encourage anyone to just explore that, because I took away from the whole experience like such an enriched sort of inner sense of, I don't know, my relationships with people and just how I interact with people moving forward. So I definitely would recommend anyone who's interested in doing it to look into it.
Thank you so much for listening to this episode of Students of Mind. I was so excited to hear about the 988 number, and I was thrilled to be able to have a conversation about it for this episode. If you'd like to get in touch with Phoebe or Dylan, their contact info will be in the description of this episode. As always, if you'd like to follow the Students of Mind team, all of our links are in the description as well. If you have a moment, please leave a rating and review for the show. Reviews help me know if episodes are landing for you and help get the show into more ears. It also gives listeners an idea of what to expect from the show. You can leave a review by scrolling to the bottom of the podcast show page on Apple Podcasts or Spotify, or by using an app like Podchaser.